Thanks, Kiana. So as the executive director for Fourth Plane Forward, I really look at the strategic direction of Fourth Plane Forward and the leadership and forward momentum, really. So really thinking about how we grow our organisation, looking at our long-term goals, and then how those long-term goals are really filtered down into our 5 priority areas that we work in, and then working with the staff team to really look at those priority areas and build programs that have a direct impact for our community, but aren't just standalone programs, but actually have a longer term impact. So through those long term goals, and really thinking about how we deliver. So that's kind of my sort of the main thrust, and then with that, I'm also really looking at sort of the day-to-day management of the place as well. So thinking financially and fiscally what that looks like for us, and then working very closely with our management team to make sure that those programs are running on a daily basis, and then also really working out there with a lot of our partner organisations and doing a lot of networking, a lot of talking with different organisations and seeing where we can link in and where we can partner together. Because this role or this organisation it's not a standalone organisation. We can only work if we work in partnership with people. So a big part of that for me is really understanding the needs of community, but then also working with all those other organisations and understanding their roles and their work, and then seeing where we can link together, and from that being able to build out programmatic opportunities and partnership opportunities. And so that's kind of the broad sort of approach that I take. So Fourth Plane Forward realistically is like, the intent was for it to always be the backbone organisation of the area, okay? Mm-hmm. And so the impact is not our impact. The impact is the impact of community and what they deliver and what they do. So to me, Fourth Plane Forward is about building the building blocks and removing those barriers, and enabling those communities and those community groups to thrive within the work that they want to do. So it's very much this ground forward approach. It's not a top down approach. And so the impact that we have is really, it's built off of the strength of those communities, in so much as how understanding how they need to do their work, what their priorities are, where they need to move forward, is really how we sort of like link into that. And so whether that's building a capacity for other organisations, or whether that's listening and learning to the needs of community and then creating programs that are congruent to their needs, is really the impact that we create. And so we're also really new at this. We've been about since 2018, but I think there's always iterations. And so I think certainly in the past year or so, as we've brought this phenomenal staff team on, that's had a huge impact just in general, but we're still learning as to where we can really have the best impact. And so a lot of the time we've been doing pilot programs, so whether that be the birth doula program that Sheila's running, or whether it's the financial wellness that Will has run, and other programs, we need to understand the needs to have the right impact. And so that's kind of where we're slowly building into, and that startup mentality as an organisation. But our impact is really it's really community based and in and around what the needs of the community are, more than anything else. And I think so we can't lay claim to a lot of things, and we shouldn't lay claim. It's about the community's successes and impacts. Mm-hmm. But creating pathways is sort of like really where I see, how we can do a lot of our best work. There has been a lot of work previously to my arrival, so whether through the city, through Clark County Public Health, through the board, and through volunteers and through staff members who are already here. So let's not forget that there's been a huge amount of work mm-hmm. done prior to the Fourth Plane Community Commons, prior to my arrival, that really helped set the scene for this. So there was a lot of strategic work done in the background, looking at economic development, looking at housing, and looking at health disparities along the corridor. So there has been this huge amount of strategic work done, and a huge amount of engagement with community and learning and understanding with community for a number of years. So that's really important to recognise, because without that, I wouldn't have been able to have entered the role and been able to speak to people with such ease because of the good work that was done prior to my arrival. So I think it's important to make sure that that's very, we're very aware of that, and very aware of the community that has been built pre anybody on this current staff team. And if we look at the issues that are stemming out today, I mean, there's a large number of issues, and I think we really have to look at the sort of the systemic racism and the barriers that has created, and the problems that that's created throughout time. So there's this consistent issue, and if you look at the community that we have here, 40% of our community identifies community of colour, and the barriers that they encounter on a daily basis, whether that's through racism, whether that's through health disparities, economic disparities, the lack of intergenerational wealth, etc. They are, there's these huge raft of issues that are there, and that's really what Fourth Plane Forward is really working on, and really looking at how we can remove barriers for folks who are marginalised, who are underserved, and our BIPOC community members, and really ensuring that's where we're focusing our work on. And so that work really focuses, as we transition from a district association to a community development corporation, is really looking into housing. Housing is obviously a critical piece. We know that there's a huge homelessness issue within Clark County, and not just Clark County, broadly. And so there's all of those issues that we don't have time to unpack here. But so housing is a significant piece for us, and I'm very excited to lean into that a lot more, and to really build out a strong long-term development goal for Fourth Plane Forward and for the community. So that housing piece is a really big piece for us. We then look at sort of economic development and what that looks like, and I think there's a huge opportunity there for us as well to really delve into what that looks like for small business owners, for workforce development, for lifelong education, learnings and opportunities like that. So there's significant issues there that we want to develop, and the wonderful opportunity that we have with the Fourth Plane Commons, with funding through the city for CDBG funding to build out those opportunities for micro enterprises to use the commissary kitchen to help build community members and build out those opportunities for business growth. And then really sort of broadening that out as we do. So I think there's some significant opportunity, but we need to think about intergenerational wealth. We need to think about breaking those poverty cycles and finding family wealth jobs. It's all well and good having a minimum wage job, but minimum wage doesn't pay for somebody's accommodation. It doesn't pay for a car. It doesn't pay for a standard of living that I'm very fortunate to have, and we want everybody to have that standard of living. So really how we're building that together, and then I think that all really links into our health, and so really leaning in for us right now. Maternal health, I think, is certainly for this community, and sort of looking at the numbers and looking and understanding the issues with the maternal mortality rates, and what that looks like for our young children as they come through, and for mothers and infants is really critical. So really wanting to lean into that a lot. And then also thinking about what that looks like for our community members and for our neighbourhood leadership piece, and really building out capacity for our community members is also a critical piece, because we can put all these programs on, but we need to ensure that people have access to them, and so we need to be able to provide access to those programs. And so what does that look like? That looks like building capacity for our community-based organisations and for our community members. So how do we do that? So there's lots of different priority areas and lots of different things that we need to sort of lean into. But they're sort of like those key areas, and then obviously, and you can't talk about that without talking about understanding and learning about our community. And I think that's the key piece when we talk about our artwork and our history work, and what that really means to us. So I think it's important that we embed all of that into the work that we do. We can't have community if we don't understand community. And so that's a critical piece for us, is really understanding community, and that happens through community art, that happens through culture, and so really also blending that into our work, and really leaning into understanding our cultures that we have here, because we have so many of them, to be able to work with them correctly and to understand a little bit better, and to remove barriers for individuals, not just a collective as a whole, because that doesn't work. We have to think, very much down to those individuals, not but community at large. But so there's all of those things that come into play. It kind of it permeates, and it doesn't matter where it sits within a large or a small problem. I mean, it's about how we deliver the work we're doing in a way that is equitable for everybody within the given space. So whether that's a small whether that's an individual issue or whether that's a systemic issue, you still have to think through that lens of equity to be able to deliver solutions for it. And so I think it doesn't matter where it sits. It's kind of it should be something that as we think about creating programs, or as we work with our community members, or as we work together as a team or work with partners, that should just be at the forefront of everything that we're doing, so that it's not just a big picture answer, and it's not just a small picture answer. It needs to cut through sort of all facets of the work that we do, because otherwise we're not being equitable. I mean, and so that's kind of the piece there. So we think about sort of upstream policy as being sort of like the nadir, I guess, of we want to understand and change what's happening at the upstream policy, because if you're not challenging and changing upstream policy, then nothing will happen downstream. And so the analogy of that is, and I'm not going to get this right, but the analogy is something along the lines of, you see a river and there's babies coming down the river, floating down the river, and then you're wondering why the babies are floating down the river, so you need to go up the river to stop the babies from floating down the river, and understand why that's happening. So a big part of that is then we need to understand what's happening. Why are those babies being floated down the river? We need to understand that, and so that we can impact and stop the issues at the grassroots level. So a big piece is the work. So say, for example, the work that Paris and Sheila have been doing with the doulas for all at the most recent legislative session. And really understand, trying to build into birth doulas, getting them reimbursed at Medicaid level. Because right now, if you look at what happens with birth doulas, for example, the vast majority of birth doulas are white, and it's generally white women that are able to access birth doulas. Historically, that's how it's been, because there's not been much in the way of training, and because the people of colour have not had the access and the opportunity to do that. Plus, there's no money there to be able to be a birth doula. So it's very much a privileged position to access a birth doula. So the change and the challenge there is, how do we shift it so that it's not a privileged position to have access to a birth doula? So by putting Medicaid funding into, or putting Medicaid reimbursement into legislation, so that if you or I need a birth doula, that's covered through Medicaid. So we have 38% of births in Clark County are covered by Medicaid. 80% of the Chinese community are on Medicaid. And so they have zero access, or very, very little access, to birth doulas. If those birth doulas are reimbursed on Medicaid, then those Chinese community members now have access to birth doulas, and so therefore a more equitable access to maternal health. And that will also mean that 38% of people that currently don't have access to birth doulas in Clark County will also have access across the board. So then we're really getting down to that smaller piece of those individuals are accessing equitable services, because upstream in the larger piece we've worked on that piece, and so our programs aim to deliver both that grassroots piece and that upstream policy. And so things like the birth doula program, there's a clear and present need for birth doulas to impact maternal health. It's significant, and so that's kind of how we think about programming, is looking at how can our program not just impact the individual here, but how can we also impact upstream policy? What does that look like? And so those pilot programs that we've been doing are all about that. It's about, where does that sit? How are we impacting upstream policy to make things equitable as we move down that river and as we get to that individual piece there. So that's kind of what we're trying to achieve, and that's what, to me, what equity looks like, is working at all the different levels, and not just at legislative, but also then getting into systems and talking with systems about. So we want culturally congruent birth doulas, people who look like you, providing you with that birth doula service, not somebody that looks like me providing you, because we're very culturally different. And so we need to provide culturally congruent services, and not just within the healthcare system, but across the systems, to ensure that everybody is accessing equitably the services that they require. And so this is just one piece for us to do that. And so being able to provide birth doulas who look like the people they're serving and have the same culture is so important. But we couldn't do that if Medicaid hadn't been authorised to pay for people to do that. And so that's kind of like that full circle piece.